So at home you have all the amenities. You can breastfeed, you can express your milk, you can store it. Then you come to the office and maybe you work 2 hours away from where you live. And then suddenly there's nowhere where you can do it.
Kenya Private Sector Alliance is the voice of the private sector in Kenya, and so brings all the sector associations and the corporates, from the multinationals to the very, very small ones, startups, together to speak in one voice on issues, policy and regulations, so that we can create an enabling business environment. KEPSA has an arm, which is the KEPSA Foundation, which is the social arm of trying to ensure that the private sector is also involved in the social issues of the country. So we do a lot of issues around youth, women, children, environment, where it concerns projects that the private sector needs to get involved in. Those are done under the foundation.
The Better Business Practices for Children, BBPC, is a project between UNICEF and the Kenya Private Sector, KEPSA. If a mother leaves home and comes to the office and stays for maybe 8 to 12 hours outside the house and they have not breastfed, sooner or later that milk diminishes and eventually dries up.
Working together with UNICEF and trying to meet the standards of the WHO on better business practices for children, that's when we thought of starting the initiative. And so that we can start encouraging our private sector to create lactation rooms, so that women can be able to continue breastfeeding even as they work.
It was really difficult for me when I was pregnant and when I gave birth, because I literally had to fight the system. Breastfeed my children, make sure they're settled in well, and come back to do the evening bulletin. My managers didn't want me to do that. And I had to threaten to leave, because my choice would have been, can I be there for my children, or do I choose work? And it would have been an easy choice for me, hard financially, but easy emotionally, and the right thing socially, because my children need their mother.
You're not getting a child so that you can become a problematic employee. You're getting a child so that you can use this great work opportunity to provide for this child.
During my time, there were no lactation rooms in our workplaces. The maternity leave used to be 2 months, and then you forfeit your annual leave if you wanted to stay with your child longer. So the maximum time we had to actually breastfeed was 3 months.
We had a security event in one of the hotels that required a lady. And as she was on post, she disappeared for around an hour, just to go and find her crying. And of course, the minute she walked out of the toilet, it cut me really, really deep in the heart, because she had all this milk that was flowing from her blouse to her trouser, all the way to her shoes. That was a serious wake-up call.
It is not right. It is inhuman for an employer to send away a cadet because she's pregnant, because that is not the solution.
There's a way you are not settled. What room am I going to use today? The server room was an open room. Anyone could walk in and out. So what I used to do is to put my seat behind the door, so that when you come and try to open, and it is a room that no one used to knock. So you will hit my seat, then I'll know someone and say, hello, I'm in here. Then they'll know I'm in there expressing my milk. That also interferes with your flow. And of course the dust, and of course the cold weather. If it's the restroom, the most embarrassing time is when I was actually putting the milk into the cup, so that I'm able to put it in the fridge. And I don't know what I did when it was on my lap, it all spilled.
I think a lot of the times people feel like, siyo ni shauri yake, kwani who told her to get a baby, or whatever, that kind of mentality, or you're like, utajisort. And that's not the right outlook to have.
If you do optimal breastfeeding, then you're likely to save about 823,000 children every year if that is promoted. Breastfeeding also happens to be one of the high impact interventions that can save lives of children under 5 years.
The issues of breastfeeding, Kenya is one of the countries that has put in place several actions. We started by ensuring that a mother can take maternity leave for 30 days and then add the annual leave, and they're able to stay with the baby for about 5.5 months.
A few years back, one of the director of KEPSA, Gloria Decay, said, I'd like you to be a champion for this breastfeeding program. We would like to see that this continues in not one, but as many companies as possible.
Try and find some way, even if it's a small corner to start with, and say, you know what guys, I'm really sorry we don't have a room yet, but use this area for now as we work towards it, but don't ignore it altogether.
And so it's important for the private sector to create those environments where mothers feel safe and also feel that they're contributing, they are not denying their children breastfeed milk.
I think why it's very important is because every individual who then is your staff member comes as a whole person, does not just bring their professional life to you.
For the private sector, even the public sector that have taken up workplace support for breastfeeding, one, that is a great way to support the workforce.
Welcome to the East Africa Lactation Room. Any corporate that is not doing this, they are missing a great opportunity to increase their engagement score of employees at the workplace. So I would encourage, if there are any corporate out there that is not yet established a lactation room or created an environment for all employees to feel okay at work, that the system, the infrastructure is supporting them to do their work as well as balance the much needed balance for both family and work, then they are missing a great opportunity.
The nursing room. Oh, yes, as my child is still on exclusive breastfeeding, so being able to have a place they can go and express, and then have a fridge. There's also a fridge, they don't mention it there, but there's a fridge that you can actually store your breast milk and then take it later when you're going home. So it's still fresh by the time you're taking it home to the child, and the child can have it the following day. And coming to work and being able to work for an employer who recognizes the need to just give you extra support really helps me feel appreciated. It also helps me when I come back to want to give more.
Wananipea nafasi na nyumba fulani niende nikamue maziwa niweke kwa fridge, ikifika jioni naenda napelekea mtoto.
What that means for you as an employer in the long run is that you're more likely to retain that employee compared to someone who doesn't have those facilities in place.
When you're recruiting employees and your employee knows that my employer cares about me, it's a very good thing for any company. When I didn't have a room, I just did the expressing for 6 months. And so after 6 months, I had to introduce any other milk that I felt I deemed right for the baby. But when I had this room, I expressed up to 10 months. Can you imagine the benefits of the child who is doing 10 months still on my milk, and the child who did only 6 months and had to introduce another kind of milk?
We're encouraging all private sector, but also public sector, and working very closely with the Ministry of Health for them to encourage the public sector to do the same, because then it improves productivity of the whole country, and also encourages mothers to be able to work and stay at work than quit during their motherhood seasons, because they want to give their best to their children, so that it's a win-win and they can do both.
All we're saying is, can you consider a room where this woman can be able to express her milk? Because her doing it in her parked car is not dignity. It's unfair. A room is all we ask for.
So you have a responsibility as companies to take this seriously, and I commend any companies that take on board initiatives that make it easier for mothers to access their children and ensure that they get breast milk as opposed to alternative milks.
If you're an enlightened employer, why don't you do it? Because it will add a tremendous amount of value of your company, not only company to your clients, but amongst your people, amongst your staff.
For the companies that have taken up setting up the lactation centers under the Better Business Practices for Children, thank you very much. And we encourage you to continue to talk about it, to encourage other companies to take up the initiative, and also to share your stories, how it has benefited your companies and the welfare of the mothers and the children.